It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my son is in ICU with a breathing tube in place. Why does the ICU team need to reduce the sedation during ventilator weaning? You can check out last week's question by clicking on the link below this video. In today's episode of Your Questions Answered, I want to answer questions from one of my clients, Thea, as part of my one-on-one consulting and advocacy service. Thea's mother is admitted to the hospital with an infection, and she's asking why do the doctors keep on convincing her to put her mum into a Do Not Resuscitate or DNR status. So the question today is, my mum is admitted to the hospital with an infection. Why do the doctors keep on convincing me to put my mum into a DNR status? Help. So Tia writes, "Hi Patrick, I am wondering if I can engage your help to make sure I provide the correct advocacy for my 98-year-old mother who is in hospital for urinary tract infection or UTI with sepsis. She's not in ICU. Mum has controlled congestive heart failure and some dementia. She has had past hospital stays for pneumonia in January 2016 for urinary tract infection or UTI, in May 2016 for cellulitis that turned to sepsis in November 2016, and resultant volume overload that caused hospitalization for congestive heart failure in December 2016, and was just admitted on Tuesday, March the 6th, 2018 for UTI and sepsis. The hospital feels like she hasn't been there in a long time, which is good. She normally lives at home and has excellent caregivers providing 24-hour care. I manage the caregivers and their care. She has 5 children and we help as well. She has a pacemaker, no defibrillator, and just changed out for the battery in August 2017. She has atrial fibrillation and congestive heart failure, CHF. She has no pain and takes 1 Tylenol few times a year for pain or fever. The prior infections and hospitalizations have weakened her, so before current hospitalizations, she walks about 50 steps a day with 100% assistance from caregivers so she doesn't fall. She has a lot of skin tears just because the skin is so fragile, and we are very careful, which makes for lots of bandages showing all over. We keep her bed sore free, except this is the one exception. She has one now that's gone ugly, but we go to wound care for the skin tears, and they will help with this bed sore as well. On Tuesday, March the 6th, her temperature dropped to 93.6 from her normal base temperature of 96.7. Blood pressure was 90/54, which fluctuated as low as 79 systolic since hospitalized. The lactic acid test at ER was 2.3 and fluids were started. Blood culture has come back with gram-negative bacteria. Her blood pressure has stabilized between 94 systolic and 120/60 last night and 100/48 this morning, and her normal temperature of 36 degrees Celsius this morning. They started with rocephin and azithromycin and now giving her vancomycin intravenously and cefepime, and added piperacillin yesterday. She's very sick but smiles sometimes, and yesterday she said, "I'm hungry." Her head hangs a lot. Even before the ER, she must have been sick for several days because she wasn't hungry and ate only 50% for 2 days. She can barely swallow now, hangs her mouth open when offered food, but wants it. She had dysphagia in prior hospital stays, but improved at home till she could eat all regular food safely again. She loves to eat. We asked for a nasogastric tube to feed her. They put one in yesterday and fed her, and it went well. Speech pathology came and recommends a tube for now as well. The nurse told me what we need to watch for now is kidney perfusion, and nurses have been hanging their heads unhappy with the urine output. She is producing a low amount of urine. The color is nice, like a lightish amber beer. 1 8-hour shift, it was 145 mils output. Mum is 138 pounds. She's on none of her congestive heart failure medications yet, except the digoxin, and the nurses are a little grim about the urine output, but the doctor hasn't mentioned it to me yet at any morning rounds. I have complained of seeing wet on pad. They really don't believe me. Today the nurse assistant saw it with our caregiver, and they did order and put in a new catheter. So maybe some urine has been going out on the pad after all. I see the doctor on the rounds each morning except today. He has not threatened me with low perfusion or any discussions of low urine output. I did tell him that the catheter was leaking on the first day, and he said they all do a little. I have heard the nurses say that the doctor says that she is dehydrated, so she is continuing IV fluids and can't give any Bumix yet until hydrated. So of course she's loading up with edema, mostly on the bottom side from lying down, and thighs as low as gravity point. We are elevating one leg at a time to try to help edema run out of the thigh. She said 2 and 4 pitting edema. I don't know the measures, but the thighs are big. Last time they sent her home this way after the sepsis with volume overload, and she didn't fit in her wheelchair. Honestly, just between you and me, we have been noticing at home that the Bumix doesn't seem to work as good lately. In fact, we even got a different generic brand recently, hoping it was the generic brand. With our recent visit with a cardiologist, she said she could stop her Altase about a month ago. Didn't want low blood pressure fall risk. And in hindsight, output seemed worse after she quit the Altase. Could be coincidental. My main questions. It has been absolutely horrible getting her care, and I have done it only from my learning from your website and your case emails that I follow. She's not in ICU, nor has she ever been. Currently, she has improved, and each day on the rounds, the doctor has said she looks better today. Honestly, it doesn't show too much, must be talking about labs. Her oxygen is 100% on 1.5 liters, blood pressure fluctuates between 94/54 and 120/60 now, and heart rate is between 65 and 85 in atrial fibrillation. On the first doctor's rounds, the caregiver was there. The doctor said she has low blood pressure. It was dipping to 79 at the lowest. Low temperature, it was 93.6, and she's now at 98. I'll put her as a DNR, do not resuscitate, everything except cardiopulmonary resuscitation or CPR and intubation. I was called to confirm, and I said she is a full code status. The rounds doctor called me to convince me to do a full do not resuscitate. Her internist called me to convince to do a DNR or do not resuscitate as well, but the doctor did change it back to full code for me. Soon after that she started getting excellent care and still is, but it's hard to keep the do not resuscitate or DNR away. I rode with Mum in the ambulance and have been with her ever since, and no less than 10 people have accosted me to put her on a DNR or do not resuscitate order. Nurses, doctors, administrators, and the subject of the DNR keeps coming up. There were 40 beds needed that day from ER. There were 15 still needed when Mum got hers. I think only because she has a respected doctor, but he doesn't do rounds anymore because he's a little older, so he has to rely on his partners to follow Mum in hospital. Probably doesn't want to burden them. What do you think? In the past, he has stuck us with hospitalists and has been very dangerous care with them. It has been excruciating listening to how I am making my mother suffer. Rounds doctors wouldn't do that to his mother. He even said there is someone down in ER with a heart attack and needs that bed. What actually horrifies me the most is that I feel maybe I should be listening and cutting her care. Before this admission, she doesn't talk much. She knows who I am and is always happy to see me. Her caregivers love their job because she's so lovely and thanks them every time they do anything for her. They love their job. Mum is so nice to them. She loves to eat and eats a healthy diet, no junk food. When she had her first UTI about 2 years ago, her doctor said you should consider hospice. It's going to be one infection after another, and it kind of has been. He just doesn't want to follow her or have her as patient because he has to put her on his partners in hospital, is what I'm thinking. She wants to live and asked, is this the hospital? Am I going to die? And she was horrified when she figured it out. Last time she was in hospital, they let the hospitalist care for her and it was awful. The kidneys were damaged. Then I'm sure getting that overload off. So, my main questions are these. Number one, please help me continue to keep fighting them by helping me know what might be coming next. I left Friday after the rounds because I feel they won't mess with us too much over the weekend and caregivers will be there and report to me 24-hour coverage. Number two, what do I need to do if in fact her urine output is not enough for kidney perfusion? She's not back on any congestive heart failure meds yet, except the digoxin. Will her congestive heart failure meds, Corex 6.5 milligram twice a day and 0.5 Bumex every other day, help enough to make urine output? Number three, is the low urine real or perceived trouble for her? Number four, how do I continue to keep the do not resuscitate or DNR away? Number five, more appalling, why do I feel like they are pushing me to cave? She has nothing but some infections. They have antibiotics for that. She has no pain except being sick from infection. But I know she is old. Number six, they make me feel unsophisticated and dirty for wanting to keep her alive and get her proper care. She believes in care and always has. Always took great care to go to the doctors in her life, even gymnastics each year, and for us as kids as well. I have 4 sisters that will support me but want to stay away so they won't be accosted by do not resuscitate requests because they don't study this stuff like me and they don't like hospitals. When they visit, they are 100% supportive, but one of them thinks comfort care is good in general and has mumbled it in front of her caregivers once before in the hospital. She and I don't talk about this much right now. I have returned to my home for a 24-hour respite with 24-hour caregivers there at her bedside in the hospital. We are texting every time. But I will return probably for 7 a.m. rounds unless I strategize to skip one. But I feel if the doctor is there, the family needs to show at that time too, to let the doctor know that we are 100% on this 98-year-old cure. Please let me know if and how you can help. Thank you so much for your help already. Haven't asked for the do not resuscitate policy to read yet. Thank you, from Tia. So, Tia, thank you so much for writing in and thank you for detailing your mom's situation and also thank you for becoming a client. So, and thank you for using my one-on-one consulting and advocacy service. I really appreciate it. So, what I'll do, I had to read through your email in detail and I'm now going to address your questions in particular. I'll just read those questions out here again before I answer them. So your first question is, please help me continue to keep fighting them by helping me know what might be coming next. You left Friday off the rounds because you felt you won't mess with them too much over the weekend and you can't give in. We'd be there and report to you for 24-hour coverage. So I can definitely help you fight them. The fight is not a good word. It's much better to say, I'll help you get what you want for your mother. Whatever comes next doesn't really matter what the situation looks like. You know, I have so much experience, therefore I can guide you in one way or another, but I clearly understand what you want, and that's for your mother to leave the hospital alive and get the best care and treatment, and I'll come to that in a moment. So your next question was, what do you need to do? So let's break this down. If, in fact, urine output is not enough for kidney perfusion, she's not back on any congestive heart failure meds yet except the digoxin, will her congestive heart failure meds, Coreg 6.5 milligram twice a day and Bumex 0.5 milligrams every other day help enough to make urine output? So, Tia, this is the issue with urine output. Urine output is not a result of, well, urine output is a result of kidney perfusion, but kidney perfusion is a result of sustained blood pressure. So you've mentioned that initially your mother's blood pressure was pretty low because of the infection, so they brought it up. So kidney perfusion really needs to be driven by sustained physiological blood pressure, and that needs to be really above 90 to 95 systolic or above 65 mean arterial blood pressure. So the digoxin will definitely help because the digoxin improves the contractility of the heart. The Bumex will help as well, but keep in mind your mother is dehydrated from what you've said. So that means even if she has a normal or a high blood pressure, she also needs some fluids to get the kidneys perfused. It's a tricky balance because on the one hand you want to keep the heart and the lungs dry so they can actually cope, but on the other hand you need kidney perfusion. So it's a fine line and a fine balance between a sustained blood pressure and not to dehydrate her. So she has a blood pressure, she has fluids that actually perfuse the kidneys. So with low kidney perfusion, you know she won't make much urine. That's the bottom line. So are the kidney issues real or perceived for her? Well, it's probably real with what you've shared at this stage. It's not perceived because you don't want to get the kidneys into shutdown mode. Next, how do you continue to keep the DNR or do not resuscitate mode away? As you know, Tia, to keep the do not resuscitate or DNR away, it's as simple as you keep telling them you want to keep the DNR away and that you want for her to leave the hospital alive. It's something you've made crystal clear to them that you want for her to live. Something she has voiced. So you don't need to go overboard. You just keep telling them, look, this is what I want for my mom and this is what she wants. And if they don't listen to you, then you can go back and ask for the hospital policy. But it's probably not there yet to ask for the policy. Just be persistent with your message and be persistent with pointing towards what your mother wants and what you want for her as the next of kin or medical power of attorney. And also, if you have an advanced care directive for your mom, if she has put something in writing that she wants everything to be done, then the hospital needs to follow that as well. Maybe you have that in writing. You didn't mention it, but if you do, make sure the hospital gets to read it. So then the next thing you say is more appalling. Why do I feel like they're pushing me to cave in? She has nothing but some infections. They have antibiotics for that. She has no pain except being sick from infection. But I know she's old, you know. It's appalling if they're pushing me to cave. Again, Thea, you got to ignore that. Yes, she has infections. You're treating them with antibiotics. You know, she's not in any pain. You know, she's sick. She's getting the antibiotics. She's in hospital. You're doing all the right things. And age is not a factor or an issue. You know your mother has her brains and her wits together. You have your brain and your wits. So again, same with the do not resuscitate order or the DNR. Just keep going back to saying, look, I want full treatment for our mom except for cardiac compressions and intubation. Everything else I want for her. Just keep repeating yourself and make sure you get what you want. It's as simple as that. Do not overcomplicate. Next, you say they make you feel unsophisticated and quote-unquote dirty for wanting to keep her alive and get her proper care. She believes in care and always has always taken great care to the doctors in her life, even at doing each year. And for us as kids, you have 4 sisters that will support you but want to stay away so they won't be reminded of the DNR requests because they don't study this stuff and they don't like hospitals when they visit. Well, it's great to hear that they are 100% supportive, but one of them thinks comfort care is good in general, and she has mumbled it in front of her caregivers once before in the hospital. She and you don't talk about this much right now. Again, Tia, don't make anybody make you feel unsophisticated or quote-unquote dirty for wanting to keep your mum alive and get the proper care. It's just what you want. It's your preference, your mother's preference, especially if she believes in care and treatment. You know, she's always taken great care of itself. So just keep going with that. And you know, and keep informing your sisters about what you're doing. It sounds like you are the decision maker, and if you have good rapport with your mother and your sisters, just keep referring back to what your mother wants, so you have returned home for now. I think that's a very good idea, especially if you have 24-hour caregivers, because you don't want to burn out. You don't want to burn out yourself by being in hospital 24 hours a day. You need to look after yourself, because this could go on for a while or for a few weeks, and you need to keep your strength. So, and you just need to keep making sure that you get what you want for your mother, okay? Any other questions, please get back to me and I will flick back in an email to you with some answers that you can take action on. Take care. So, here is the return email from Tia. Hi Patrick, thank you for your help. Perhaps I've done wrong with Mum's status choice. You wrote the following. Just keep going back to saying, look, I want full treatment for our mum except for cardiac compressions and intubation. Everything else I want for her. Just keep repeating yourself and make sure you get what you want. It's as simple as that. Don't overcomplicate. So I have to ask you this, Patrick. I have mum at full code, which includes cardiac compressions and intubation, because I am afraid that any type of do not resuscitate means she will not really get very good care, or maybe even the room or the bed she has. I just don't feel that she would get the same care with a lesser status than full code. Than the lesser status of the full code in the hospital. They haven't described the various choices of do not resuscitate well, just telling me, do I want her ribs crushed? But I felt it was safest to go full code and then it's clear. And I would like to leave it like this unless you think I'm risking anything else for her that I'm not thinking of. Like, might they discharge her sooner so as not to have the liability of a 98-year-old full code in the hospital? In other words, would full code give her any negative that I'm just ignorant of, other than them thinking I'm ridiculous? But if not, then I would leave it here. I don't want her to have cardiopulmonary resuscitation or CPR or intubation at her age, but I feel I would see a decline first and be able to change her status. And if she were to start to decline, I am right here, not by phone across the country as many children might be. Our experience is my uncle was allowed to choke and die as he fell ill in the cafeteria, choking, while people stood back and said, he has a do not resuscitate, don't help him. My mum is quiet today, but the caregiver feels she is the same and not worse than yesterday. My question is, she typically has high blood pressure without her heart medications. I would think it would be 140 systolic by now. Especially with all the volume given and edema and the liquid food with 954 milligrams sodium, which she eats, less sodium than that at home. At home natural sodium in the Mediterranean type diet, no added salt for congestive heart failure. But with recent skin infection, her blood pressure tended to go down. In fact, we held some heart medications when her blood pressure under 100 during that infection. But after that, she was well again. Her blood pressure became higher again to carefully add back heart medications. Are these reasons blood pressure readings strong enough? The last lactic acid test was 1.6 on March the 6th. Why isn't her blood pressure any higher by now? They just hung another bag of antibiotics, piperacillin or tacicin, if that tells you anything. So Sunday, March the 11th, the blood pressure was 100/48 at 6 a.m. It was 93/43 at 12:20 p.m. It was 98/48 at 4 p.m. and 97/48 at 8 p.m. Monday, March the 12th, blood pressure was 94/48 at 4:30 a.m. 8 a.m. it was 101/43. At noon it was 91/45. Thank you so much for your help. From Tia. Hi Tia, thank you so much for clarifying your mum's situation. I read your first email as if you wanted everything but cardiac compressions and intubation. If you want full resuscitation status for your mum, it would include cardiac compressions and intubation. There is certainly no guarantee for anyone to crack ribs during cardiopulmonary resuscitation or CPR, and there is also no guarantee for saving a life during cardiac compressions either, but it increases the chances. Do not let anybody make you feel bad about you or your mother's choices always keep in mind that it's none of your business what other people think about you or your choices. This is a critical mindset to have. Age is not a determining factor of somebody having full code or not. Outlook on life, personal beliefs, personal preferences and quality of life are the determining factors of your choices and nothing else. Again, do not make anybody feel you bad by saying, do you want her ribs to be crushed? You can't control what they are saying, but you can control your reaction to it. With severe infections, often one of the first signs is blood pressure going down, therefore withholding heart medications makes sense. Given that her blood pressure is still low and they are starting antibiotics again, there's a very good chance she is still battling an infection. An infection is bringing blood pressure down. Lactate 1.6 is slightly elevated, which could be a sign of an infection. Keep asking for her temperature as well as white cell count and CRP for infection markers. Also, have they done more testing like sputum urine tests to isolate a potential bug and treat it? They may have done so, which is why she's getting the tacicin. With blood pressure low, they will need to keep watching her urine output because the low blood pressure might compromise her kidney perfusion. Please also ensure she keeps getting mobilized to prevent the pneumonia and just get her going as much as you can. It will also prevent pressure sores. Also, if she's swollen, she may need furosemide or the Bumex to get the swelling down, especially with a weak heart, congestive heart failure. You don't want to fluid overload a weak heart. I hope this all makes sense. Please let me know if you have any other questions. And before I forget about it, you mentioned the lactic acid test at 1.6. That's pretty low. Lactate acid above 2 or 3 could indicate an infection. The higher it gets, it could indicate an infection. So, they need to check for the infection markers. Again, keep checking temperature and keep checking the lactate test as well. So, thank you for watching. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section For more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone, via email and via Skype, by clicking on the products tabs on the top of the website, or by just giving me a call on one of the numbers on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.